Welcome to the live stream, guys. I'm here today with Dr. Inky-Shrink. Dr. Inky-Shrink is a doctor in psychology. I'll let you introduce yourself and welcome. It's the first time on my podcast. I'll let you introduce yourself, and we're going to talk about a host of topics today. But the title of this conversation is the human condition. And yeah, it's going to be an interesting conversation in relation to psychology, the social aspect of the society, issues relating to mental health. It's packed, it's going to be entertaining, it's going to be interesting, and there's a whole lot to learn from this conversation. Welcome to the podcast. Introduce yourself.
Thank you, thank you. Yeah, my name is Dr. Inky-Shrink. So I work in psychiatry in America, and predominantly, I study obviously the human condition, but on a day-to-day basis, I typically tend to, I do a lot of medication management. So kind of people that are requiring medications to treat their mental illness, and so the day in and day out is just kind of treating my patients, finding out what's going on in their lives, helping them cope with these things, but also again using medications when necessary. And yeah, I'm excited to be here.
Yeah, welcome. Let's get straight into it. Let's start with mental health. This is your background. What are the biggest systemic challenges facing mental health care in America today?
Yeah. So America, it's kind of a, I mean, I guess mental health challenges are everywhere. I would say in America, the biggest challenge, like with all healthcare, is access. Some of it is a big part of it is just the cost of care. Like most people, like the way our insurance systems are set up, it's really challenging. Um, and a lot of policies weirdly will not cover mental health. So there's many people who pay their premiums every month for insurance, but it covers like regular medical stuff. So it'll cover, just like primary care, OBGYN, like those other specialties, but sometimes they will have these carve outs in the plans where they're not where they won't cover mental health services, which is unfortunate because it's such a massive need. I mean, we're seeing all over the globe like huge rises in people struggling with various types of mental illness. And yeah, so in America specifically, I would say cost is a big factor, and also just access to mental health care. So, like what I do, it's not common. Like, so when I went to medical school, like I was kind of the weirdo going into psychiatry. Everyone was like, oh, why don't you go into cardiology? Why don't you go into surgery? All these other things. I love mental health care. I love mental health treatment. So for me, psychiatry was what I wanted to do, but it just isn't a popular field to get into. So a huge piece of it is just that we don't have enough providers like me, especially that prescribe. We have a lot of people who are therapists who can do talk therapy. But, so for me, in the state that I'm in, because there's so few providers that can actually treat these conditions and use medications, people sometimes will have to drive hours to see me. And like, I mean, luckily with the development of telemedicine, a lot of people I can see remotely now. But so I have people that are, I mean, 8 hours drive for me that see me because there's just no care in their area. So especially in more rural areas, there it's like almost impossible to get care for mental health, and especially if you need medications. So, I mean, I think access to mental health treatment is probably the biggest issue. There's just not enough providers to care for the amount of people who need the care.
Yeah, would you say it's a systemic problem? Would you say it's an area that people don't have interest in terms of, getting into that profession? Are you saying that there's not enough funding from the government or enough incentive to go into it? So what is that, or is there some sort of people having some sort of stuff with mental health and say, oh, I don't want to go into that area, and there's you know people shunning it basically. What is the real problem? Why don't we have enough people working in that area or in that sector?
So yeah, it's interesting. I think frankly, it's a lot of stigma. I mean, before I actually was in med school, I mean, when we're training, we have to, so I've worked in the ER in the operating room. I've worked in a lot of different settings, and there is genuinely, even in medicine, a very large stigma with mental health. So when I was working in the ER in the emergency room, for example, if someone would come into the emergency room with like a mental health crisis, all the docs in the ER would just kind of be like rolling their eyes, like, oh, someone else deal with that. I don't really want to deal with that. Because there is this perception of that if someone's struggling with mental illness, like that they're automatically like crazy and that everything's going to be difficult and they're going to be very behavioral and problematic, which of course sometimes can be the case. But a lot of the times they're just people that are struggling. So I think from what I've experienced, I would say that's the biggest reason people just don't go into it because there's this stigma that it's going to be really difficult. You're dealing with very, very difficult individuals. There's certain diagnoses that I'll admit, there's certain diagnoses that if I have a patient that is diagnosed with these particular disorders, they are not easy patients to deal with because they're dealing with, again, abandonment issues. They can be very needy. They lack boundaries even with their providers. I mean, I've had patients that I've had to get restraining orders against because they were stalking me, quite literally. So it's definitely a niche population. It's not like, oh, you're going in because you have a sore throat and you get an antibiotic. It's a much more, it requires an element of intimacy between the provider and the patient. Whereas in a lot of other specialties, you can just kind of treat them and send them on their way. You never see them again, or it's only for really simple things. Whereas it requires a lot of vulnerability, like it requires being more vulnerable even on the part of the clinician. It's not, at least for me, I'm not overly formal with my patients. I like to talk with them just like I would my friends because I want them to feel comfortable and not like they have to walk on eggshells around me. So, but in doing so, that requires a good element of like empathy and like, so it opens us up to kind of burnout as well, because if you're not careful, it's hard. It's very difficult caring for other people's mental health, especially in the mass amount of numbers that we have to do it. So, yeah, I think overall the problem is people don't want to go into it because they think it's a difficult patient population. And yeah, and I think that they are worried about burnout because there's a very high burnout rate in medicine in general in America, but mental health specifically, because again, we're not talking about lighthearted things. I'm talking about heavy topics day in and day out with my patients about really,
Yeah,
really horrific things that have happened to them. But I encourage it. I have students from the medical school now come to like shadow with me, and I kind of let them see what it's like on a day to day, and really because I try to encourage more people to get into the field because I love it. It's an interesting field. The human mind is fascinating, and it can be quite flexible even just from a standpoint, like I'm a single mother myself, so I've got two kiddos. I can kind of cater my schedule around to what I want, whereas if I were working in the OR, that's not happening. I have to just work whatever they say. So there is a lot of incentive, frankly, to work in psychiatry. Just people, I guess, don't want to overcome that stigma or the
yeah.
requirement
Now,
to do.
speaking of stigma, how does this stigma around mental health in the US compare with other societies?
Yeah, I think we've done in the States, we have a big awakening. There's definitely been a lot more awareness for mental health, and there's a lot more like campaigning for it, like normalizing these struggles, normalizing going to therapy. Like all the time now, you'll see people with bumper stickers on their car, like therapy girly, or like I took my meds today kind of thing. So there is, in our culture, we have had a massive, maybe in the past like decade, I would say, I feel like we've seen this trend of there being a lot less stigma where people are realizing like, hey, a lot more people struggle than we realize. And so we are definitely improving. And so, in terms of comparison of other cultures, I would say I think the States has come further than a lot of cultures because, again, even within the United States, there's definitely factions of different cultures where there's a lot more stigma. I would say in the African American community, there's definitely more stigma. So I definitely see, like, I'll have a lot of African American patients that come to see me and they're quite embarrassed, like they don't want their parents to know they're seeing me. So they're, even within the States, there's these kind of cultural factions that affect stigma. But yeah, I mean, obviously, as you know, I've spent time living in Africa when I was younger, so I've seen definitely some other parts of the world. And I would say, from my own experience, it felt like the stigma was greater in Africa specifically. I do feel like there was a lot, it was a lot more taboo to struggle with these things. Where I lived in South Africa, I feel like there was a perception that if you see a psychiatrist, that you're crazy, like that you're automatically, you must be hearing voices, you must be you need a sangoma, like whatever it is that they would
Yeah.
think. You know what I mean? And so, whereas
Hmm. Yeah. So
you know,
people
but
think there's
but
some sort of in African society, when you begin to see like a psychiatrist or the clinician or whatever, they think there's some kind of spiritual, attack on you or spell. And like you said in South Africa, you are being
Sangoma,
called by by the Sangoma
yep,
and so on and so forth. Yeah. So for those of you just joining, this is a live stream broadcast. If you have any question for Dr. Shrink, you can leave them, at the end of every section. I would, relay the questions to her and she would, respond to them accordingly. Don't forget to also hit the subscribe button, hit the notification bell so that anytime we do any of these sections, you can have access to it. But most importantly, like and share this video to get more outreach. And if you have any question, like I said, you leave it in the comment. So we'll be taking the questions. So before we go to the next stage, I would let's look at the people that have in some cultures. Somebody said, Appel Passion said, in some cultures, they hide their relatives with mental health issues, specifically diagnosed patients.
yep,
Would you say
yeah,
that
and
is an accurate, description?
100%. Yep. So I've definitely seen that, especially in more like in developing countries, especially like I've seen that in the Middle East as well, where they will have a family member who does have like schizophrenia or something more severe where they're hearing voices. And often, even though they know that's going on, it's like totally under wraps because it has this kind of implication of shame almost associated with it. And of course, many cultures, even in America, there is that kind of tie of like what's mental illness and what's spiritual, like so there is
Mhm.
always this like a lot of people have questions of like a spiritual component to these things, which is understandable, but many people also just don't understand how the brain works and how some of these things happen purely biologically. So I think in a lot of cultures, especially if there is a big component of spirituality to that culture, I think there's a lot of shame attached because then they think, oh, what has the family done that's flawed or that might have brought this kind of sin or this demon onto this person to create these symptoms. So yeah, I would agree with the Pell that yeah, there's definitely families who they kind of keep these diagnoses of their friends of their family members under wraps just because they fear shame and judgment. And
Yeah. So the next question I have for you, doctor, is drug problems and addiction. Why has the opioid crisis hit America so hard compared to other countries? It's a big problem. It's a giant problem in the US. What is the
giant
cause
problem.
of it? Yeah.
Yeah, I mean it's complex. I think part of it, frankly, is that in America, we are very pharmaceutical heavy. Like we are med people. Like we don't like natural remedies. We want the quick
Mhm.
fix. Like we're in that like, I mean in many cultures are that way now, but we like a quick fix. So people don't want to go to physical therapy for their shoulder pain. They just want the pill that's going to help them feel better. And so there is that kind of mentality in terms the patients themselves, but frankly so many docs are just they're so liberal with how they prescribe opiates. And so I do a lot of addiction medicine as well in my practice. So I have many people that are struggling with opiate addiction and I treat them accordingly. But it's hard because I would say so many of them started out in a scenario where like, oh, I was in a really bad car accident, I fractured my spine, I dislocated my hip, some sort of injury, and then they're prescribed these opiate pain pills. But many doctors are prescribing in really like inappropriate amounts, like where it's like significantly higher amounts. I mean, even when I was rotating in OBGYN, a girl had a just a clean out of her uterus. So it's like a pretty simple procedure. It's not there's no actual incisions. And the OBGYN that I was shadowing at the time, I think prescribed her it was like 100 and something of Percocet 5s, which is a relatively powerful opiate. And it is, I mean, for that procedure, for example, she would not need maybe 10 to 15 pills for the few days following the procedure at the most. But he just doled out this massive dose. And so that's part of the problem is these doctors, will just prescribe them. And so people take them exactly like they're supposed to, exactly like the doctor is telling them to. But then the problem is that the opiate, we have, they're called mu opioid receptors in our brains. And so these receptors are very sensitive, and so that's why it's so highly addictive is because then they're only on it for this shortened period of time as they're are supposed to be like post-op for surgery, but then they've been taking it so consistently that really when they pull away from it, they're starting to get these physiologic withdrawals, and opiate withdrawals are really miserable. They're not actually fatal, which is people have a misperception, but you really it's very rare to die from opiate withdrawal, but it feels like you're dying. So it's really really dysphoric physically, mentally, all of the above. So people don't want to feel that way. So it's like, okay, now their doc's cutting them off because they're like, oh, you're 2 months past surgery, you can't have anymore. And so then they go to the streets because they're like, I'll just buy some heroin off the street, I'll buy Percocets off the street or fentanyl. And so they end up taking these illicitly just purely to avoid withdrawal. And so they kind of end up in this vicious cycle. Yeah, so it's a big, big, big problem, especially the state that I'm in, where there's been movies made about it, like in terms of we have really, really massive crisis in my area. So we see it, and fentanyl is massively on the rise. Like back in the day, we would just see like people would take a pill that they bought off the streets and it would be laced with fentanyl. But now we have people that are actively using like pure fentanyl, which it's extremely potent, and the overdose rate is insane. So we
Yeah,
just
so
see so
you see these videos of people, on the streets where they are like bending halfway down and
yeah, they're
like
kind of like
zombie like
yep,
figures on the streets, like half dead. Somebody will be standing in an awkward position for hours on end, and they're like homeless. It's a giant problem in America. And
massive.
where are all these, illicit substances coming from and flooding the streets in America? And what is the government doing about it? That's the first question. And secondly, is this addiction primarily a medical issue or a social issue or both of them?
Okay. Yeah, I mean, and so in terms of where it's coming from, I mean, they are getting fentanyl itself. I think we get definitely from down south in kind of like Central American countries, but we also are seeing it come in from China as well in terms of just where it's being manufactured. But and I'm not team like, oh, this is everybody else's problem, because us as Americans, we do plenty of work on our own to create this issue. We have large manufacturing stuff that goes on within the walls of the United States as well. So people fake press Xanaxes, which is a sedative for like anxiety. So we manufacture a lot of this stuff within, both in small and large operations. And so we are a big contributor to the problem as well as a society, because there's money to be made. Unfortunately, that's what I always say, is follow the money. So individual kind of drug dealers that are small operations, pharmaceutical companies that are big bazillion dollar corporations, they're also making money off of this too. The more Percocet that's prescribed, that's the more money they're making. So we are a very capitalistic society in America, and so follow the money. So I think it's multifactorial. I think in terms of your question about like, is it medical versus social, I think it's a bit of both. It's very multifactorial. It's kind of controversial because there's a lot of people who view addiction as just purely social. They're like, oh, well, if you chose to use it, you should be able to just choose to stop it, like just stop. But then people don't realize, I mean, I've studied neurochemistry as a good part of what I've studied in my career, and there are genuine like biologic and chemical changes that happen in the brain. There's a process, we call it down regulation, where the more you're exposed to a medication or any foreign substance, your receptors in the brain for that chemical realize, oh, we're getting a constant exogenous source of this medication, so we don't need as many receptors. So when your brain is, which is so smart, our brain is such an intelligent organ, we are downplaying the amount of receptors that are available. So then it becomes a point where these receptors are no longer, like, they're saturated with all these drugs, and then they're not getting the same high because it's not hitting so many receptors. So it requires them to do more, or to do it more frequently, or more potent things. So there is genuinely, like, at a very kind of smaller, not cellular, but like on a more on a deeper dive level in the brain, of where there's really genuine changes that are taking place, where it physiologically there are changes. So people don't just magically, you know, become addicted. There's a reason they become addicted. And so, partially, yes, I think it's very much medical and biological. I mean, a lot of the research that we see shows that people that do get into medical treatment, so we call it MAT treatment. So that's what I do, medication assisted treatment. That's where we really statistically see the best results of people actually getting like sobriety and maintaining it, is because we're actually
Mm,
using medications to kind of help slowly upregulate those receptors again. So that way they're not just cold turkeying and feeling those withdrawals, like in terms of physical symptoms, but we're also not, what am I trying to say? But we're also not, having that kind of psychological dependency. It allows their brain to kind of gently wean off of things. So everyone has difference of opinions on them, but statistically, medication assisted treatment is where we see the best results, and just anecdotally, that's where I see the best results as well. Is it because if we try to do it
mm.
just through therapy and 12-step programs and these other things, I don't know the exact statistic, but the vast majority of people end up relapsing. They do not stay
Yeah,
sober at all. And so there is definitely a medical and biological component to it. But that being said, a huge piece of it is social and societal. Most people that I've encountered that do end up in addiction, again, either they started off getting medications from a doctor and developed this biological addiction from being on these medications for longer than they should have. But then I also, a lot of people, it's just purely a self medication thing. They're dealing with anxiety, they're dealing with depression, they have problems in their family, problems with money, they can't afford to live in in our society. And so a lot of people just turn to drugs to self medicate. They don't want to feel the pain of kind of the things that they're encompassed with socially and those burdens. So that's how a lot of people just start, is they're like, I just want a little something to take the edge off. And their friend will be like, oh, I have a Percocet. And so it'll start that way. So very much also a social issue, because the vast majority of my patients, they start, it starts as a self-medication thing where they're just really trying to treat their own mental illness incorrectly, and it kind of spurs into an addiction. So it's very
yeah,
multi.
yeah, yeah. The last part of what you said is that, in as much as it's biological and medical, it's also the social aspect of it. So, how do poverty, unemployment, and inequality feed into this, drug problem in the United States?
So greatly. So just like I was saying, these circumstances, we definitely see higher levels of addiction in people who are of lower socioeconomic status, people that are disenfranchised, homeless communities, etc. Because I think, again, and it's not just because there's something innately wrong with them. I mean, there's definitely people who are very well off who use, tons of cocaine. So it's not like it's an only lower income problem, but we do see it in disproportionate numbers in those kind of communities. And again, because frankly, when you think that, like when you're struggling, we have this thing called Maslow's hierarchy of needs. And so it's just kind of this
Mhm.
concept of like, what are our needs as human beings? And so those basic needs, food, water, shelter, like basic needs, when those aren't being met, that's hard. So you're not even remotely beginning to think about those, like about emotional and psychological issues, because you're just trying to literally survive. So people that are in that state of just trying to figure out where their next meal's coming from, where are they sleeping tonight, those are things that are highly, highly stressful on the brain. It takes such a massive toll on our psyche, even if they don't realize it. So those people, and they don't have resources. And again, with stigma, you see homeless guy on the corner of the street that might be struggling with his mental health, people automatically are like, oh, he's just junkie. So they end up, it's almost like a self-fulfilling prophecy. They end up turning to drugs often because no one's helping them. No one cares, unfortunately, in greater society, and they just see them as a scourge in society rather than somebody's son or somebody's brother, that has these struggles. And so,
Yeah.
yeah, but so yeah, huge ties with kind of these, with, I would say, for me, I think one of the biggest ties I see are financial struggles and addiction.
Yeah, having said that, before we move on to the next topic, there's a question from Jamal Lisan who says,
Yeah.
how do I know if I have a mental illness, doctor?
So, I mean, so depending on what kind of symptoms you're struggling with, I mean, it's not always easy depending on where you are in the world, but the best way to do it is to see someone like me because I'm trained in all of these diagnoses. And so I can kind of, or someone like me can go over whatever symptoms you might be having and we can kind of tease out what exactly might be going on. Because every human being does to some extent experience sadness, they experience anxiety and stress. So, and but that doesn't necessarily mean you have mental illness. There are kind of what I call healthy and normal levels of sadness or anxiety, just in response to circumstances. To that's being human. So, but to kind of find out when it kind of crosses that threshold into no, this is truly a mental illness, and this is something that's not just only circumstance. I mean, it's best diagnosed by someone like me because you know that we're going to be assessing it correctly. A lot of people use, of course, online resources. So there are you can look up. There's a book called the DSM-5. That's what kind of most of the world uses to diagnose. And each diagnosis in that book will have kind of criteria. So a lot of people, if they don't have access, you can kind of look up, like if you think you might have generalized anxiety disorder, for example, you can look up online and see what the criteria are that you would typically see in someone diagnosed with that and kind of self reflect and figure out like how many of these things are you struggling with and where you might fit into that bill. So that's the most definitive way is to see a doc like myself. But again, but again, some self reflection and kind of looking into these different diagnoses that you think you could struggle with and seeing where you kind of stack up to those criteria.
Yeah, this is really educational and eye opening. So, if you guys want to participate, like I said, leave a comment, and the doctor will be here to shed light on some of the topics or the subtopics that we've been discussing so far in relations to mental health, drug addiction, and other of physical, biological, psychological, social issues in the United States and around the world because she's an expert and she's traveled around the world as well. So she's well equipped and informed in this aspect. So let's move on to the next topic, which is single parenthood in America. So my
Yeah.
question to you is, what are the psychological and sociological challenges unique to single parents in the United States?
Hmm. Yeah, I mean, so again, I would say a big issue, just kind of like we were talking about, is just the lack of resources. So America, it's an expensive nation. Like I mean, we don't, the amount of people that work their butts off and work two and three jobs, but still cannot make ends meet to pay for the cost of living and pay for the cost of everything, our health care, like all of these things. So it's challenging enough for even a two-parent household. So finances are a massive stress for people. But then I think specifically with single parenting, it adds on a whole nother dimension because that single parent often feels very alone. They don't have someone backing them up financially. And there are resources. Of course, we have social services resources, but unfortunately, many people don't meet criteria for that in the States. Like they'll make more they'll make not enough to live, but more than the threshold that would qualify them for these government services like Medicaid and food stamps and things like that to kind of help them make ends meet. And so it's challenging for people. And that's, I would say, the population that it's the most challenging for, the ones that are like not poor, but they're low income, but just above that threshold where they can't really survive on the income they have because then they just fall into this kind of warp hole of like no one's helping them. They're not well enough financially to help themselves, but then the government's not willing to help them either because they make too much when clearly it's not too much. And so,
Are you saying that? Sorry to cut you off. Are you saying that
no,
this is
yeah,
by design? Are you saying that this is done deliberately by design by the government in order? You say, well, we have the social services in place, but it's only for the people at the bottom of the totem pole, like they say, or like for the very few that you say cannot meet the threshold. But there are a lot of people that are in quote meeting the threshold or have surpassed the threshold, but are not earning enough to take care of themselves, let alone the kids that they have to take care of alone.
right. Yeah, I mean, that's a loaded question. My personal opinion is yes, it's by design. Again, we in America love our money. So big corporations, the top earners, and there's people that stand to lose money, and including our federal government. And so that's why even with this most recent administration, we're seeing tons of Medicaid cuts, which we already are not caring for our citizens enough. I mean, there's so many people that don't have access to health care. And so, yeah, I think it's because it requires more money. We like to spend a lot of money, but I would say we spend it in a lot of ways that are not helpful. They're definitely not for the benefit of American people for sure. Yeah, I mean, because I mean, and people don't, I think a lot of people from other nations don't understand how expensive our healthcare is. So if you're uninsured, like, for example, someone like me, like the going rate for someone like me is about $300 for an hour. That's would be a cash price. That's a lot of money for 1 hour. And so the vast majority of Americans cannot afford that. So if they don't have health care, if it's not tied in with their job and they can't afford a premium elsewhere and they're above that threshold of being able to get free health care through Medicaid, then they just don't get care. And so that ties back to the whole mental health thing. People can't afford it. And so, I mean, I charge exponentially less than that because I'm not about that life. I want people to get care. But
Mm,
that's kind of the standard going rate. And my colleagues think I'm crazy that I charge less than that for people who are uninsured. But I didn't get into it for money. I want people to be well. And so, yeah, I mean, so it's challenging. So people just don't understand. I mean, and because of the way pharmaceutical companies, insurance companies are set up, they are. I mean, the prices are insanely inflated. I mean, insanely inflated. If someone goes, for example, slightly off topic, but if someone goes to the ER and they need to do a pregnancy test on them, for example, to make sure before they do any treatments that they're not pregnant, if it's a female, that tag, we can get that pregnancy test at a Dollar Tree, like $1, $1 US, whatever. But in the ER, if you actually look at an itemized statement, it's usually about $100, give or take.
mm,
So for the exact same test, like literally, it's the same thing you could buy at the Dollar Tree for $1, but because it's getting billed to insurance prices, it's not a socialized system. It's privatized, so people can charge what they want, people can pay what they want, in terms of these companies, and so it's jacked up the prices in immensely, and so yeah, so people just can't get the care they need. And so, yeah, so I think our government does, they want to spend it on other things. They have other interests at heart, unfortunately, many times than the actual welfare of the American people.
mm.
So, yeah,
Yeah,
so there's
yeah,
a lot of
but
people.
yeah, yeah,
Go,
but
yeah,
let's talk about the society itself, the United States.
yeah.
Is it? Would would you allude to the fact that the American cultural emphasis on individualism affects single parents, compared to more collectivist societies?
100%. Yeah, 100%. I mean, when I moved to Africa, that was the first thing I noticed. And I don't know what in South Africa, they called it Ubuntu. So, like that
Mhm.
spirit of Ubuntu, everyone was together. Like it was no questions asked. Like if someone in your community needed something, it's like, why would you not help them? Like everyone had such a collective perspective. And I loved it. I mean, genuinely, it made me cry. Like when I first started experiencing it, like I had never growing up in America experienced something like that, and it's what made me stay for much longer than I intended to stay in Africa, because it was something so beautiful, and we really lack that in America. I mean, I'm not saying no, like no one's good people. Americans are beautiful people, but we do absolutely live in a society that's very much individualistic, and so yeah, I mean, we don't. So in terms of single parenting, people don't really help each other out. I mean, there are, you get like church groups and kind of smaller nonprofits, things like that, that try to kind of bridge the gap for people like this. So there are people that definitely make efforts to help. But as a society as a whole, no, we're very individualistic. We all care, we drive home from work, we get out of our cars, we go straight into our house, we don't say hi to our neighbors. Like there's not that same kind of collectivist culture at all. So
Mhm.
yeah, I think our individualistic society does have a massive impact on single parents because they feel alone, like they really do. So the
Yeah.
government's not helping them in many cases, and then the society around them is not helping them in many cases in their own communities. So unless they are part of like a church group, I would say that's where most people get support in those kind of scenarios, is if they're part of whatever faith church group that they go to. Often there will be resources them to kind of like band together, help them get groceries, help them with whatever. So it comes in small spurts, again, predominantly through kind of the NPO, NGO type communities. But other than
Mm-hmm.
that, yes, societally, no, it's very individualistic. And so it's challenging for people in general. But yeah, single parenting is hard. I mean, parenting is an amazing job. Most people that are parents love being parents, but it's a 24/7 job. So someone that works a job, so think about a single mom, she's having to work 2 to 3 jobs just to make ends meet so she can even afford her apartment or flat where they live. But then so she's exhausted burning the candle at both ends, but then she doesn't get to just stop when she gets home. She gets home and she has to care for her kids. She has to cook, she has to clean. She can't afford a maid to help out. She can't afford, someone to come cook for her. So it's not like there's help in that sense. And so yeah, so it's like you versus the world 24 hours a day. And so there's a
Yeah.
massive rate. Yeah.
And talking about individualism is, the US and most of these Western societies, including countries in Europe, countries like Australia and New Zealand, they have this model where it's just the man for himself. He drives home from work, doesn't say hello to the neighbor, and some of
Yep.
them live this solitary life. And somebody might die in their room, and nobody will know for 2 months or 3 months. It's not like that in Africa. The society in Africa is distinct. You know,
Right.
um, you as a child, you are a child of the community. If you do something wrong, an auntie from the next door can discipline the child and say, "Oh, you are not allowed to do this." This is
Right.
the way African society is. So, yeah,
Right.
you're right. It's our society is quite distinct from what you have in the Western culture and
I
society, and
miss that culture. No, it's true.
yeah,
I mean, honestly, so even like, so say you saw a neighbor kid, like here, a neighborhood kid doing something wrong, likely another parent would not say something to that kid because they're going to be like, oh, I don't want to offend the parents. I don't want to overstep bounds and tell them that their kid's doing something wrong. So no, I mean, it's genuinely, it's very individualistic. And so, yeah, we don't have that like aunties telling us like, grabbing the shoe and being like, you need to get it together kind of thing. Like we don't get that here. Yeah, so it's a very, very
yeah.
different
Going back to, I don't want to go back to mental health, but I mean, I need to go back
kind
there because there are some questions that I missed out on, and I let me see whether I can wrap them together. So the first
yeah.
one is: do you think that sleep is a key element to combating mental health? Do we need more sleep clinics to train people to sleep without medication? That is number one. And
Yep.
secondly, does private practitioner receive government subsidies?
So yeah, so the sleep question, yes. I mean, literally with all of my patients, that's the number one thing I'm talking about with them because I tell people tell my patients all the time, think about even if we have no mental health issues at all. If say you're not struggling, you're not anxious, you're not depressed, but if you get like a really bad night's sleep, automatically the next day you are going to be less motivated, you're going to be more irritable, you might be more prone to anxiety, find like more sensitivity with caffeine, coffee, whatever. And it does, so it affects our mood and our psyche the next day just from the lack of sleep. So then when you take somebody that's also at baseline struggling with mental illness and then you're adding in not sleeping, yeah, sleep is like kind of the foundation of mental health for me. So when I'm dealing with patients that are struggling with mental health, if they're not sleeping well, that's my number one thing I'm addressing. Like before we even talk about, I mean, we talk about the anxiety and the depression, these other things too, but it's a huge catalyst for exacerbation of mental illness. And so yeah, sleep is absolutely key. And it is hard in American society. We use medication a lot. That's a quick fix. Now I try to take more of a holistic approach. I own my own practice, so I can kind of do things how I want. I don't work for anybody. So for me, I like a holistic approach. I don't want people to just rely on medications. Many medications are not healthy. They can be harmful, and so I'm not naive to think otherwise. And so yeah, but there isn't enough emphasis on sleep health. We do live in a society where we call it sleep hygiene in America, where I mean, they say in theory we should not look at any electronics for an hour before we go to bed, which for me is nuts because I'm on TikTok till the moment I fall asleep, probably. um, So, but yeah, so there's a lot of things that we can practically do that really do affect our kind of our circadian rhythm and kind of our normal body's natural cycle to sleep. And so, yeah, there's definitely more needed in terms of people being aware of how to sleep train or to like actually allow themselves to get quality sleep as well, because people can sleep but not be actually going through all of the sleep cycles, and so that's going to affect everything as well. Yeah, so for me,
Yeah.
sleep's detrimental to mental health if you're not sleeping. And
Yeah,
then,
it has been an interesting section so far. So we've
yeah,
touched, a host of topics: mental health, drug problem, and addiction. This is for those of you just joining, by the way. And we've talked about single parenthood in America. So the next topic is suicide. It's something that's also a giant social problem, as
yep,
much as it's related to mental health and so on. So why
yep.
is suicide rates rising in certain age groups in America, particularly among the young people?
Yeah, so suicide is a tough topic. We've had a lot, I mean, globally, I would say it's a tough topic. There's so much stigma, even when you see a mental health provider. So, for example, when a patient comes to see me, many people are so scared to talk to me about that they're having these kind of thoughts because they think or assume that I'm automatically going to send them to like the psych ward where they're going to have to be in a straitjacket. Like that's the perception, is that if you have these kind of symptoms of like thoughts of wanting to unalive yourself or thoughts of just kind of in that realm, many people fear consequences, like almost like there would be a punishment for them feeling that way. Because unfortunately, in America, we're a very litigious society. A lot of practitioners and providers, docs they just think about lawsuits, literally. Like so many of my colleagues will be like, as soon as somebody says the S word in their chair, like if they have a patient, they're automatically sending them to the hospital. I'm like, no, I'm like, this is because the hospital can do more harm than good for a lot of people. It's not a fun place to be. You're mixed with a variety of different mental illnesses altogether. So sometimes I feel that it can do more harm than good. So to me, it's important as clinicians to use critical thinking, because if you look up the criteria for major depressive disorder, one of the symptoms of it is thoughts of suicide. And so I don't know why people are surprised that somebody who's struggling with depression might sometimes have those thoughts. So there's a lot of that stigma. So for me, I mean, I've never been sued, and God willing, I never will be. But I care enough about my patients that I don't want there to be harm in them going to the hospital just because I'm scared, like, oh, what if they try something and I didn't send them, I might get sued. So I like to read between the lines, because there's a lot of, when it comes to suicidality, it's complex, and it's not, there's different kind of levels of it. So we have what we call suicidal ideation. So that's the idea of just people are kind of having these thoughts in their mind, like, so I often will document them in my chart as passive death wishes. So they don't necessarily want to actively die, but they're kind of just like, like, I'm just sick of my life. I wouldn't be mad if I died. Like if I got hit by a bus today, I wouldn't really be upset about it. So it's not, they're not actively trying anything, but they're struggling enough with their quality of life and their mental illness that they're okay with the idea of death passively. So for me, that technically is a suicidal ideation. It's a thought about suicide, but they don't have any active intention to do anything about it. They don't have a plan. So, and again, we think about means, like, do they have access to firearms? What kind of medications have I prescribed them? Because people don't forget that a lot of, especially females, die by suicide by overdosing on meds prescribed to them by psychiatry. So it is something we also have to be very mindful of, what we're prescribing. So if they do have suicidal thoughts, we need to be careful of what we're giving them and how much we're giving them if they ever go down that road. And so, sorry, I rabbit trailed. What was your original actual question about it?
Yeah,
I'm sorry.
yeah. Yeah, exactly. Yeah, I think you have, what you've done is to talk about like the medical side of it and the role that, the practitioners like yourself, have
Yeah.
to play. But the original question was about the rising level of,
Oh,
suicide in
it
the
was
US,
just,
particularly among a certain age grade, particularly the young ones, the young people between the age of, let's say,
yeah.
17 to like 25 or 30.
Yeah, so there is, thank you for reminding me. So yeah, there is a massive, massive rise of suicide rates in younger populations. And I think part of that, I mean, it's very multifactorial. Of course, with COVID-19, we saw a huge influx of just pediatric and adolescent mental illness in general, like we've never seen. I've always seen, like, I see kids and adults. So I've historically seen kids, but COVID-19 and beyond, we have seen exponentially higher levels of depression, anxiety. So I think people being kind of locked into their homes for extended periods of time. And frankly, I think the rise of like social media and screen time and things like that plays a big role. When I was a kid, there wasn't really I mean, the internet was like such a pedestrian thing at that point. So we have a lot of issues with cyberbullying. So I have many patients. I mean, I unfortunately have had a patient at the age of 8 attempt suicide at 8 years old. Luckily, they were able to be resuscitated and survived. But that's, I mean, when I was a younger, I would have never fathomed even, I don't think I even knew what suicide was at age 8. And so we really do. You know, we have in my state, we have a girl a couple months ago that was 10 that actually successfully took her own life because she was being bullied at school. So I think the access to the internet, social media, a lot of younger kids, play Roblox, for example, and there's a lot of messaging on these apps. And so while they are innocent games, there's a lot that goes on beneath the surface. And so these kids are mean. I mean, kids are bullies for real. Like they are bullies. And so I've seen a massive tie to that. So the cases that I've had personally where there's been attempts in younger people, a lot of it is related to just bullying. And you have to keep in mind that the frontal lobe isn't fully developed. So our frontal lobe is a part of our brain that deals with like critical thinking, reasoning skills. And so people in general don't have a fully developed frontal lobe till they're about 25, and that's being generous, and that can vary. So kids that's why I think about, when you have a 14-year-old who gets broken, like their girlfriend dumps them. For them, it feels like literally the end of the world. Like they do not have the mental capacity to reason and say, okay, this hurts right now, really stings, but there's light at the end of the tunnel. I'm gonna meet another nice girl down the road. So part of that I think is just there's a lot more again with the cyberbullying and kind of this online, there's just so much more awareness of things. Kids are doing things, talking about things that we never did prior to the rise of social media and just a kind of online life, so to speak. And then again, pairing that with, so I mean, there's people literally, like, I mean, my own children on Roblox, there's been people that have been in those things telling them, oh, you should just kill yourself, like saying stuff like that. So people are just mindless and they say stupid things, but then they don't realize kids are so impressionable and they don't have that capacity to reason. And so if they are remotely struggling that way, then they might try, frankly. And so that's a big part of it. Also, I would say there is also a large rise, over time in America, we're seeing a lot more acceptance in general of the LGBTQ community. So we're seeing a lot more people come out of the woodworks and being proud to be part of that community, which as they should be, as I feel. But because of a rise in that, especially in adolescence, so we do see like extremely disproportionate numbers of suicide in youth that are of that community. So I think that's another big player here
But
with
why?
because
But
people are
why?
mean. People are mean. Society is not kind to them, especially the trans community. So trans people, or think the statistic is about 4 times more likely to attempt suicide than somebody who is not trans. So they are exponentially, the society is stacked against them. There's so much hate towards this
Yeah,
community.
but here's the thing: when you're saying that there's more acceptability in America and other Western societies, it means they can come out openly and be themselves without the fear of being in the closet, or with the fear that drives them to go to the closet. So
Sure.
if they are able to come out like that, why is the level of suicide or the rate of suicide among the people within the LGBT community so high?
Just because I would say it's more accepted in the sense that it's less taboo. Of course, there's very supportive communities in America. I would say much more so than some nations for sure. But let's not forget there's a very loud and proud community in America that is extremely anti-LGBT, extremely. So yes, there's less, what am I trying to say? Like I think people feel more empowered because of the acceptance that's happened. So there's more people that are willing to come out of the closet, so to speak, and be open about who they are and not feeling like they have to hide that away. but because of that, they're opening themselves up to more susceptibility to scrutiny and things like that. And so people are, I mean, I've witnessed it firsthand. I have a pretty large trans population as patients, and it's insane the things people say to them. And so whether somebody personally or morally or spiritually or whatever reason they agree or disagree, these are human beings. They're people, and so they deserve to be treated with dignity. And so there is definitely a massive amount of the US that is very anti this community or these communities. And so it's an uphill battle. And you have to keep in mind as well that people, like especially adolescents and the LGBTQ community, a huge part of it is that they don't have support. They don't, so many families disown them the second they come out as trans. Even though they felt empowered to do it, their parents are like, oh my gosh, like what's my church going to think if I accept you? So it's just like a shunning automatically. And so it's a fear of judgment from the people around. So a lot of people lose their families, they lose that support system. And so that, I think, in that community is where I see the highest rates of suicide, is people that really just don't have a support system. So they feel like they're just like going through life entirely alone. So apart from their few fellow LGBT people that they've kind of taken under their wing, they don't have that familial support system. Everyone kind of left them high and dry. And so they feel like they're walking an uphill battle. Not to mention, of course, there's societal changes too in terms of the government. We're seeing a lot of anti-trans legislation, things like that. So they just don't feel protected. And it's unfortunate because they're in America, for example, trans community makes up only about 1% of American population. So it's such a hot topic, but really it's such a small proportion of our society. So I don't know why people are so obsessed with it, and like why people are so anti other people's life choices. But yeah,
Yeah,
so we do
yeah.
see huge suicide rates there.
Yeah, so having said that, apart from the health system, how can communities play a role in suicide prevention?
Mhm. I think part of it is awareness. I think, a big part of it is just talking about it. Like there's a lot less stigma, but there is still so much stigma. Like I said, even patients are scared to talk to me about it, and this is literally what I do for a living. So there is still stigma. People don't realize how much, like, or excuse me, how many people in society struggle with suicidal thoughts and thoughts of wanting to unalive themselves. It's way, 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 way more common than people realize. And so I think that's part of it is people feel isolated. Like I'm the only one that screwed up this way. So I think when people do, for me, like something that's been really impactful for a lot of my patients is, I show them this story. There's a guy called Kevin Hines who actually attempted suicide by jumping off the Golden Gate Bridge, and he survived. His story is amazing. And so he's now a mental health advocate. He goes all over America. But so many of my patients that struggle that way, they hear his story and it like it just stabs them like in a good way. Like it makes them feel like, whoa, like that's exactly how I feel. And like how, and he talks about how like the moment his hands left the rail, like after he jumped over the bridge, like it was like an instant regret. Like he felt like, oh my God, I'm about to die and I can do nothing about it. And I shouldn't have done that. Like it was, he said, an immediate regret. And so there's so many people that attempt suicide and live and say the same thing. I've had many patients that have survived suicide attempts, and the vast majority of them were like, it was like an instant regret, and then now I have to live with the kind of the trauma of that event now. And so I think the more people that share their stories and like that vocalize, normalize that these symptoms do happen and people struggle this way, I think that's how the biggest impact can be had, because people don't want to shed light that they struggle in that way because they're worried of judgment or worried of getting put away in the psych ward. And so I think societally a big way we can help is just by not normalizing it like it's okay, but normalizing it in the sense that a lot of people struggle this way. And so if more people could feel less alone in that way, they would realize that they're not alone and that it's okay to not be okay and that they just need to get help.
Yeah, like I said, for every section we take questions from the comments. So I'll try to add these two questions together. The first one is, do you think social economic areas have the highest rates, suicide rate? Do you think socioeconomic problems, contribute to the suicide rates? I think that's what the person is trying to write, which
Yeah,
is a
yeah.
pearl.
Okay.
And secondly, um, what is your opinion on high suicide rates amongst men?
Okay. Yeah. Socioeconomic status, I think, definitely plays a role. Like we talked about earlier, I think we see higher levels of addiction, mental illness in kind of lower socioeconomic classes. But I think part of it is, but I would also say, just on the flip side, we see, I mean, I've had patients that have taken their own life that were literally billionaires. So I think that, yes, it plays a role for sure, but it doesn't discriminate. I've seen people on kind of all walks of life. I've had pastors that have attempted suicide, and then, that were my patients. I've seen people, white, black, old, young, Hispanic, rich, poor. So yes, I think socioeconomic status has a role in terms of, again, external stresses and why they might get to that point of feeling overwhelmed. But for sure, just anecdotally, I've seen it in every single echelon of society. I don't think I've seen a huge discriminator of who this can affect, for sure. And then in
Yeah.
men, yeah, suicide rates with men, there's much higher suicide rates because they choose methods that are successful, frankly. Men are much more likely to shoot themselves. It's the most surefire way. I mean, like, if you're gonna do it, like putting a bullet to your head or in your mouth, way more often is going to be a successful attempt to die by suicide, versus like if you women, like I said earlier, are more prone to like overdosing on pills, whereas that's a much slower burn. So if somebody finds you in time, you can be brought to the hospital. They can pump your stomach, they can put charcoal, they can, detox you out of these medications. There's medications to reverse overdoses, those kind of things. So we see a lot more high successful suicide rates in men because they just choose methods that tend to be more sure,
Efficient and
efficient,
very effective. Very
effective ways.
effective.
Although it
Yeah.
it can add, I've seen many patients that have unfortunately, attempted by shooting, and they survived, and it's not a fun life. It's
Yeah.
really,
So
really,
there's a story that's been told about the French Revolution.
yeah,
And during the French Revolution, people like Maximilien de Robespierre and people like George Danton, who were like the forefront of it, was basically more of an intellectual, revolution against the monarch, against King Louis the 16th,
yeah,
because of the rising social and economic problems right around that period. And then they said that the French, were hanging some of the people that they saw as enemy of France.
yeah,
And basically, you know how they were used to kill them before they put them in horses and drag them, and torture them before they kill them.
yeah,
And during the revolution, they invented the guillotine blade. So the guillotine blade is like a large metal,
yeah.
with
That
sharp edge where they have to like draw the rope and leave it to chop off the head.
right,
And because the French claim to be humanists, they said instead of, causing people pain and suffering them before they die, why don't you just take off the head, and make it more effective and painless? So, and
right,
exactly, I think it also relates to this idea that men find more effective ways to do it faster than trying to jump from the bridge or trying to, so they just get a gun and put it in their head. Yeah,
right.
it's crazy.
It is crazy, yeah, and it's interesting to see because people don't realize the vast majority of people as well that do attempt or that want to attempt, most people, even though they like are like they find it desirable, like the idea of being not alive anymore, it still requires an element of like courage. Like most people, before they get to that point where they're going to do it, they are terrified because it's like, what happens after death? Like, what's really, I mean, there's so many existential questions that come up after death, period, no matter how we die. So it does, so I think it takes a lot of, frankly, balls, like to choose to do it by gun, because it's like there's not much turning back from that. Whereas I think a lot of females feel, um like a lot of females are more afraid of that, and so they're afraid of that, like, certainty, so that's why they tend to choose things that are a little bit more wishy-washy in terms of success rates. And so, yeah, it's an interesting topic, but it's hard. I mean, there's a lot of people that I've experienced, a lot of my patients that have attempted, they often have to drink or do something beforehand just to kind of get that liquid courage to kind of successfully go through with it. So,
Yeah, definitely. It's mental health is a giant problem, and
I
you won't really realize most of these things we're talking about until, I mean, for somebody in your own line, you see people every day with a lot of challenges. People attempting to take their own life because of economic problem, social problem, problem with family, which gets us to our next topic, which is incest and abuse. Now, my question is from a psychological standpoint, how does incest affect long-term mental health outcomes?
Yeah, that so incest is an interesting topic because it's much more prevalent than people realize, so we people think about like childhood raping and essaying of children and these kind of things that occur. Most people in America, it's occurred at the hand of a family member. It's way, way, way. People always think it's like this creepy guy, coming in and doing something to your daughter. No, I mean I think it's. I would have to look at the exact number, but I would estimate I think it's like 60 something percent of kind of these essay scenarios in children is father to daughter, like their own daughter. So that's way, 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 way more common than people realize. I do a lot of trauma work, so I would say I have a very high level of trauma patients and PTSD. So it's kind of one of my bigger specialties that I do in my work. And you would be absolutely surprised at how many people have had incestuous abuse. And so there it affects them greatly because there's so much shame associated with it. I mean, it is such a horrendous thing to be, so for example, on the topic of grape, like many women, there's so much shame that comes along with it, period. Like even if it was by a complete stranger, there's a huge element of shame and guilt for something that of course they didn't even do, but it's just many women or men, anyone that's a victim of SA in any way, there's a shame element that comes along with it just because it's like it's something so private, it's something so vulnerable. So then add in the fact that you were raped by someone that's your family member, your grandfather, your brother, things like that. It's such an element of shame because it is so taboo. So a lot of people in that have had those kind of encounters don't get mental health help because they're mortified of having to tell somebody that they were raped by their dad. It's something that is so shame provoking in people, but it's way more common than they when we realize. I mean, I have a patient myself that has 3 children that were all fathered by her own father. So she's born 3 children that were all a result of rape by her father. And that's what wild, and that's just one girl. I mean, I have so many people just on my personal caseload that were SA'd by family members. So incest is way, 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 way more common than people think. People, because there's kind of this stereotype of like, oh, hillbillies all just sleeping with their siblings, and that happens, but that the vast majority of incest is not consensual. It's in a situation where it's not consented, so that is there's a violence and an undesired component to it. And so, yeah, it's a huge taboo, huge, huge taboo, and but way, way, way more common than people realize. So yeah, it's tough.
Okay, and you reckon that it has like a long-term effect on the mental health of the individual, of the victim?
For sure. Yeah, I think so because it's like it's complex enough to deal with any kind of trauma. Like any of us that go through trauma, it's usually yeah, it's a very specialized type of treatment. It's not the same as other anxiety disorders. We have to go even with medications and therapeutic techniques, it's different. We go through a whole different process. And so trauma in general is very difficult to overcome, but then when there is that element of like it's kind of like a mind f like the fact that you had this at the hands of your own father, so it's like the person that was supposed to protect you, that's supposed to provide for you, care for you, have your back, is the very one that's perpetrating this abuse on you. And so it carries a much bigger burden. And so yeah, I would say that most people that have dealt with incestuous SA in any form, yeah, it's frankly it's a lifelong challenge. And of course they can get
Yeah.
better, they can improve. There's ways to improve our quality of lives and overcome trauma. But yeah, I mean it's typically a problem that we see that affects them for life, for sure.
Yeah. So, what role does like silence and taboo? Because this is a taboo topic, people don't want
Yeah.
to go close to it. They say, "Oh, it's this stigma attached to it." So, what role does silence and taboo in American society play in perpetuating abuse within families?
Huge. I would say a big role, because it is like I mean, so kind of like Appel was saying earlier in the sense that like people hide mental illness, members of their family that have mental illness because they don't want that stigma and that shame. Same thing. Like if you you want to get your daughter help. I mean, I have many patients that that's the case. And so I have several family members that I see all together, and they're kind of this whole cluster of situations. And so, for example, the there's a mom and dad, and the dad was R-ing the daughter for a good portion of their life. Mom found out, was so mortified to get help for her daughter, because she was like, I don't want people to find out that that's what my husband was doing to our daughter. Like, I don't want that cat out of the bag. It's going to bring shame on our family, on our church community. Like, we don't want this talked about. So they kind of swept it under the rug. But now, many years down the road, that daughter that was essayed by her father for so long never got help. So now I actually see her children as well. And she was a perpetuator of SA towards her own children. So she has a son and a daughter that she was sexually abusing at her own hand as well. And so I'm now seeing these kids that are, I mean, so it's a multi generational thing now. We've got all of these family members that have been as incestuously abused by their family members, and it's gone untreated because of that stigma and that taboo of it. Because everyone was afraid, like, oh my God, like, if this is such a nasty topic, like, how am I gonna, ever let somebody know that my husband was essaying my own daughter? So yeah, and they never got help. And now that, because of that, now these two beautiful kids, I love them like they're my own kids. They're such beautiful souls, but they have so many psychological issues. I mean, the world is stacked against them because they are so mentally jacked up. And it's also much less common for a female to be the perpetrator of sexual abuse. Definitely happens, but it's less common. So, for example, this little boy now, I mean, he struggles like that. His mom essayed him. Like, it's such a taboo topic, that especially. And so, but luckily his grandmother, who has custody of them, um, found me, and so they've been seeing me for years now. And so these kiddos are actually, so finally grandma realized, we got to let this cat out the bag. Like, I don't care who knows, because if something doesn't change, these kiddos are going to end up doing the same thing to their kids. Like, it has to got to kind of break the cycle, break the curse, so to speak. So yeah, I think we see the taboo and the fear of judgment on that topic 100% hold people back from getting treatment and getting help for their loved ones, because they just fear it's an uncomfortable topic. It's not fun to think about for most people.
Yeah, it's been an eye-opening conversation. It's been, fireworks. It's been, you've dealt with the questions, completely. I don't know how to explain. You've dealt with them really well, and yeah, it's a lot, of stuff we've learned so far. So for those of you just joining the stream, I urge you to like, to share, and subscribe to the channel. Also, leave your questions so that the next time we have Doctor back on the stream, she's going to respond to your questions. I want to take you to another topic which is also related to mental health, but in the realm of politics.
Yeah.
War and PTSD.
Yeah.
Why is PTSD so prevalent among US veterans, and how does it affect their reintegration into the society?
Hmm. Yeah, that's an interesting topic. So I live in a very large military area as well. So I have a ton of both active duty and veterans that I see for PTSD. So so the military government insurance and everything, they refer them out to me just because there's not enough care for mental health within the military. So they see me as an outside doc. Um, yeah, it's really prevalent in the US, I would say, comparatively to military communities in other nations, but in terms of statistics. But I think part of that is because we have such a unified body. We have the Veterans Affairs, so we have a unified governmental system to help veterans. So I think a lot of our vets, even though it's still a massive problem in our nation, a lot of our vets have more access to care, so they're getting that diagnosis of PTSD. Whereas in other nations, I don't think I've seen as much emphasis on it, so they're not getting help, so they're not getting diagnosed. So even though they might be suffering with those symptoms, we're not seeing that formal diagnosis come through. So of course, statistically, it's going to show lower levels of PTSD, but it's likely just because they haven't gotten the help they need in order to treat it. And so, um, I think another thing in terms of American culture, I'm no expert in how other nations view their military. I get everyone has military pride, but I would say that America particularly takes a large amount of pride in our military. We're very much like, go USC, go USA, Team America. Like we're going to fight the wars, we're going to save all the everything's. So a lot of people in our country go into the military. They enlist. They don't really, know what they want to do with their lives. So they think there's it's kind of this painted picture of the military with rose-colored glasses. So a lot of people sign up for it thinking like, oh my gosh, I'm going to be a hero. I'm going to go fix all these issues in the Middle East. It's going to be amazing. So they're not getting painted an accurate picture of what that actually means. And so people get deployed to the Middle East and it's a rude awakening because it is not at all what they expected it to be. They're seeing both civilians, a huge part of the patients that I see, a lot of their PTSD is not from their combat, like their comrades in arms being unalived or being injured. That is a big piece of it. But a lot of it is just the psychological toll that they realize that what our military is inflicting on civilians in those nations. I mean, I've had many Iraq war veterans, Afghani war veterans that they came back and that was the biggest toll on them is they were like, I cannot believe how many children or innocent people that I saw unalived at the hands of our own military. So I think there's this misperception that it's just war. Like you're just going to be fighting combat guys. There's never going to be, casualties of war, whatever you want to call it. But so a lot of them, they're rudely awakened when they get there at what war actually means, and that it's a dirty money making business. It's a lot more that meets the eye than just the war itself. And so there's a lot of things that are underhand at a deeper kind of seedy political level internationally. And so, yeah, so I think a lot of vets go into it in America thinking they're going to be this hero and it's going to be this amazing thing. We're killing the bad guys, but then a lot of them come back with the perception of like who really is the bad guy. Like they like this is not what they thought it was going to be at all. So a lot of my vets, that's what they deal with is kind of the like almost like I was the bad guy in a lot of ways. And I was forced to do things I didn't want to do. I was forced to do things that I wouldn't morally want to do if I wasn't under control of being in the military. They have to do what they have to do. And so yeah, so it's really multifaceted. We're again, like I said, I'm no expert on how the perceptions are of war with other military states in other countries, but I think a lot, I would argue that a lot of other countries, they go into it kind of knowing more of what they're getting into. There's not as much of that, like, wow, I'm going to be the hero. I mean, there might be some of it, but I think they have a more realistic perception of what war entails. I mean, think about Africa. Many nations of Africa have seen war. Like they've lived it firsthand even before they were in the military. So they're well aware of kind of the detrimental effects of war. Whereas in America, we don't get war. We don't have war on our turf. So most Americans don't know what all is actually entailed in war until they go out and are serving in the
Look at
military
the
and
film.
see it. So yeah, so I think that's a big
Absolutely. So, as somebody that have traveled around the world,
yeah.
how would you, spot the differences, between how veterans in the U.S., deal with trauma compared to other countries? I think it's part of what you've explained before that it's kind of different in Africa and some of these places and some of the societies where you have, a constant state of, war and chaos and, conflict. So, but how would you spot the difference, or what are the differences, in how American veterans deal with, trauma than how other countries, veterans from other countries deal with trauma?
Yeah, I mean, I think I did, touch briefly on it. I think part of it is that we have a lot of I mean, again, there's still not enough resources, but we have a good amount of resources. We have the VA set up, so there is at least some form of resource. Now, I'm not saying there's not problems, there's not wait lists, et cetera. Like there is definitely not enough mental health care for vets, and that's why I see them outside of the military because they need care, and there's not enough people to care for them. And so but we have overall more access to it. Whereas I think in a lot of other nations, there isn't like these formal things set up to kind of aid veterans and helping them transition out of military life and back into kind of civilian life. And then as well, like you said, I mean, a part of it is that Americans go to war, they come back, they get to debrief, they get to get help, etc. If it goes the way it's supposed to. Whereas a lot of these other people that are fighting in their own military, the wars in their nation, so there's no end to it. Think about Palestine, think about Congo, like these nations that are kind of perpetually in a state of chaos and death and all of these things happening. They don't even have time to decompress. Like they're not even processing their trauma. So they're not even in the state to recognize again how these things are affecting their psychiatric health and their psyche, because they're so busy just trying to survive. And so I think that's a piece of the problem, is that they're not dealing with their mental health PTSD symptoms, because they're probably not even aware they're experiencing them, because they're so in the trenches of what's going on. It's a perpetual state of that. Whereas in America, yes, people can be deployed for years, but then there is at some point a reprieve where they get to come back to America and debrief and figure out kind of the next steps of their lives. Whereas in these nations, namely, like talking about Palestine, for example, people that are trying to fight militarily in that sense, it's perpetually under war. There is death and destruction every single day. So they don't even have a moment to physically survive, let alone process what's happening to them mentally. So I think that's a big piece of it, is a lot of these nations, so soldiers and sailors and stuff aren't getting they're not treating their mental health and their PTSD, because they just don't there's not been a reprieve. There's not been any sort of respite for them to even go down that road mentally. They're kind of in the zone. So when people are kind of in an acute state of PTSD, it's go mode. It's our amygdala is our part of our brain that deals with our fight and flight, kind of that PTSD response. And so we kind of nickname it the watchtower of the brain. So its job in our brain is to look for danger. So if you are literally constantly surrounded by danger, literally, like if you're waiting to avoid getting blown up and unalived, your amygdala is always on fire. Like it is always firing, it's always on red alert, it never calms down. And so people that are in that perpetual state of fight or flight with that fiery amygdala, as I like to call it with my patients, they're not even like they are in the mode, like they're just in the zone. It's like they're not even remotely outside of their own thoughts to process what's happening to them. And so until they get that respite, then that's when the amygdala will calm down a little bit, and they'll start to realize, like, holy crap, like I'm not well, like this is affecting me greatly. So but when they're just in the trenches, they're not noticing how much it's
Yeah.
actually.
So speaking about war, which is this is the penultimate question.
Yeah,
Let's talk about Gaza. This has been going on for a period of about 2 years
too long.
after the incident of October 7, 2023.
Yep.
The Israeli army have gone into Gaza and they've been carrying out operations in Gaza. Yeah, but my
Yeah.
question for you in that regard is, what is the psychological toll of this prolonged war and starvation in Gaza?
I mean, it's major. I mean, I would say this war specific. I mean, all war is bad. Like all war is bad, but I think many of us that have been kind of following this more closely, we can see that it is disproportionately horrific. There's reasons that people are looking into like war crimes, etc., because there is. So despite what somebody feels personally on the topic, so it's not. I'm not here to debate about who's right or who's wrong, but what's happening in Gaza is, I would say, it's exponentially worse than many, many other wars. There is no, the kind of rules that are in play in war and in occupation aren't being followed. And so they are, as we've talked about, like starvation at exponential rates. I mean, some of these people that you're seeing, it's horrific what's happening. And so I would say, any victims of war that are kind of under, you know, genocide. I know these are controversial topics, but kind of in these genocidal states, it's so hard to mentally survive. And just like we talked about much earlier, the Maslow's hierarchy of needs, they're not getting basic needs. Like they don't have shelter, they're living in open air prisons essentially. They're
Mm,
literally starving to death. They're not eating, they're not drinking. And so people are
yeah.
just being unalived in record numbers just from starvation. And so that's it's been a long time that we've seen that in war, like where that's a huge source of the unaliving of the civilian population is purely through starvation. And it's
Mm,
horrific. I mean, I literally saw I mean they showed this image just this morning. I got it where a doctor, they have this like little tape measure that kind of helps you to see if a kid's growing at the right rate. And this little, I mean, I think the kid was like 4. I mean, in his little upper arm, I mean, I kid you not, was literally, it was a bone. Like it was a
yeah,
bone with flesh on it. It was so, so grossly malnourished. It was unbelievable. And so,
yeah,
yeah, so
yeah.
those effects are huge psychological effects, because not only they afraid of being unalive from bombs, from guns, from all these things, drone strikes, etc., they're also worrying, where's my next meal? Moms are worrying, like, I'm starving, but my kids are starving. Like, how it's my job to
Mhm,
protect my children. How am I going to protect them when there's no resources? Like, I have nothing to give them. And so that
mhm,
takes a huge toll on parents. The desire to want
mhm,
to care for your kids, to care for your elderly parents, that's innate. And that's in that sense of Ubuntu. Like, we should be together. We need to help each other out. So when somebody has literally got their hands tied from being able to have Ubuntu, they can't do anything about it. They are literally screwed. So that's such a psychological toll. They feel
mm,
helpless, because so beyond what they're actually experiencing, they don't have a solution to get out of it. They don't have any ways to alleviate the issue. They're just stuck. They're waiting to die essentially. And so that
yeah,
is huge, huge
yeah,
psychological.
yeah. Just like you said, I don't think it's about you giving your opinion on political issues. It's just speaking in generality, in
Especially
terms
in
of your
terms of mental health.
profession, in general, and the impact of war, whether it's in Gaza or what we're seeing in Sudan. So the host of conflicts around the world.
For
But I know
sure.
this. A lot of people have been talking about the situation in Gaza. It's been getting a lot of press, and
Yep.
there have reports that have come out. So again, it's not about giving your opinion, like you said, but it's about the how this connects to mental health issue, the issue of relating to starvation, trauma, and how it fucks with the mind and people losing their lives basically. So it's
For sure.
speaking in general terms,
And,
in terms
and
of the
even
impact of war on individual and on the society, and in this
sure. And
case is Gaza.
in that, just on that point, even just if you look at the actual, like, there's so many IDF soldiers who are coming back from these wars with immense psychological issues. So kind of like I was talking about in America, they're required to
Mhm,
serve at 18. So they're going in thinking like, oh, I love Israel, so I'm going to help. But then they're seeing firsthand and having to experience what they're doing. And and so so even on the side of the IDF, it's taking a massive toll on these soldiers on that side too. So war in general, I mean, I'm a pacifist at heart. So like I don't like war in any fashion. I don't want anyone unalived. I don't like it. But I get it's part of the world. We're probably never going to see a day where there's no wars anywhere, but it does. So even no matter what side of the spectrum you're on, these things take a toll on people's mental health. And so it's detrimental, and it's ongoing. The fact that this has been going on for, like you said, 2 years at this point, it's a long time for soldiers to be fighting, and it's a long time for civilians to be fearing their lives, so it's just it's a mess, it's an unfortunate situation. And we're going to see, like, God willing, there's going to be an end to all of this, especially with the Israeli Palestinian conflict right now. But again, I don't think we've not touched the surface of what psychological impacts are going to be. So just like I said, once the dust kind of settles from all of this, people, whether
mhm,
they're fighting civilians, there's going to be this massive rise and people needing psychiatric care, especially in Gaza. I mean, the people that are fortunate to make it out of this alive, like, they are going to have a host of mental health issues. And I mean, my goal is that I hope I'll be able to go there and serve and be able to help people with their struggles kind of post war. And so inshallah that'll happen. We'll see. But yeah, so no, war's tough. It's tough on everybody. Not a
yeah.
fun
Yeah,
gig.
it's been a packed section so far. We've talked on a host of issues,
Yeah.
relating to war and PTSD, incest and abuse, suicide, single parenthood in America, drug problem and addiction, mental health in America. So finally, let's talk about individualism and and the issue of collectivism that I spoke about earlier. But in this case, let's look at Africa versus American society. And I'm
Yeah.
sure you've been on these two continents yourself. And
Yep.
so my question is, how do community-based values in many African societies shape mental health resilience compared to the US?
Yeah, and I know we kinda briefly touched on that topic earlier, I mentioned Ubuntu. Yeah, so for me, having lived in Africa for a number of years, um I felt like mental health I was surprised how well people's mental health were considering. So if you take like if you compare the apples and oranges of like American struggles and struggles in the Cape Flats, for example, where I lived, it's not the same. And then I get there's cultural differences, but the poverty in America is very different from the poverty in the Cape Flats. I mean, it is, there is destitute poverty in Africa for sure. And so I was really surprised when I lived there at how well people handled these struggles. So of course they struggle with money, they struggle with there's tons of violence, there's so many issues at hand in South Africa, but despite that, I was surprised by how well people were able to cope with those struggles. And a big part of it was what I experienced in terms of that Ubuntu, that togetherness. It just felt like in the community that I lived in Lower Crossroads. It's a kind of a small community in the Cape Flats outside of Mitchell's Plain. And I loved that community. I'm not kidding. Like it was, I'd never experienced that in my life. And it was so amazing to see, like genuinely, it was like mind boggling to me as a Westerner because it's like if somebody was struggling and they couldn't afford to get water for their house or whatever, it was, I mean, no questions. Like somebody would else go to Pick and Pay and buy them some water, or somebody else would be like, oh, well, I have this, you can help me. Like it was just like you didn't have to remotely worry. Like if somebody in the community was struggling, they didn't have that anxiety of like, how am I going to make this work? How am I going to figure this out? Because it was like an automatic, they knew one of their aunties, somebody was going to help them get what they needed. It was just like it was like that, almost like that assurance of like, I've got people in my corner. Like somebody has my back no matter what's going on. And that was so beautiful to witness. I mean, genuinely life changing for me personally. I had genuinely never experienced that. I was like it was just such a mind fuck for myself just experiencing that because I'd never seen that. Like I'd never, and so that for me, I think goes a long way. And I think on many of the topics we've talked about, I think it alluded to the sense that a lot of people, when they struggle with mental health, a part of it is that feeling of aloneness, that feeling of single mothers feeling alone, people in the LGBT community feeling alone. So much of it is just that people don't feel like they have that Ubuntu. They don't feel like they have people that have their back, that care enough about them to worry about their own struggle, and to feel part of a family and a community. And so that is what I saw in Africa that I felt like was such a mitigator for mental illness. It's not that there wasn't ever mental illness, but they felt like, okay, despite my struggles, I know that my family and my community has my back and I'm going to be okay. So, whereas in America, we have much more of an individualistic society, we feel alone. Like everyone in America feels like, I mean, genuinely, you can be part of a big family, but it's a separateness to everything, which we touched on before. And so many Americans feel very lonely. We do.
So,
And so,
yeah. So
but
in order to add to that, so you're saying that in Africa, because of the extensive, extended family system, where you have people coming together as a community with the spirit of, togetherness and Ubuntu, like you described,
yeah,
it's more beneficial for the
yeah,
well-being of the individual, for the mental health to, as a buffer against things like loneliness and addiction, and
yes,
even, other than what you have in the West, which is right down individualistic, capitalist in nature, and which end up, making the society a bit less well off in terms of some of these variables that we've pointed out.
absolutely. Yeah, I mean, it's a very stark contrast, and I see that 100%. There is so many times, like, with my patients, I mean, 99% of the time, the ones that aren't doing well don't have people in their corner. They don't have family support. They don't don't have social systems, they don't have any support, and that's where their mental health tanks. They have nobody around. There's not a family unit. There's not a even like you said, kind of that extended community family unit. We do not have that as a whole in America. We don't. So people live in these massive neighborhoods where there are, these big communities, but nobody knows each other. Like you couldn't, I mean, I lived in this huge community before. I live a little bit more rural now where I live. I lived in a huge community of probably of hundreds of houses, and I couldn't tell you anything about any very I had African neighbors next door. They were from Tanzania, so I knew them really well. But other than that, most of the people in my neighborhood, I couldn't tell you what they looked like. I couldn't tell you what they did. I didn't know anything about their lives, nothing. So that's how our culture is set up. And so we are, if we're struggling, we don't feel like we have anybody to rely on. We don't. We
Yeah.
feel like, okay, I'm
Express.
struggling, I'm screwed. Like I got to figure it out. So it does. It creates a sense of loneliness and despair that I think, there's, yeah. So I feel that all the time here. I'm like, gosh, if we could just get that Ubuntu, my practice is actually called village psychiatry because I love the idea of it takes a village. Like we all need to help each other out in order to be well mentally. And so, yeah, I mean, we need that in America. Like we could take a page out of Africa's book for that 100%. I think we'd be a much better
Yeah.
society.
One last, as we come to the end of the conversation,
Yeah.
we've touched a lot of areas. So for those of you watching this after the live stream, do well to subscribe to the page. Leave a question so that the next time Dr. In comes around, we'll be able to uh, go through some of your questions, and respond to them. And yeah, if you have any questions, even if you want to reach out to her as well, you can also leave a comment and would forward your messages, appropriately. But before we go, what do you love about Africa? With your time in Africa and your experience in Africa, what do you love about Africa?
Everything. I mean, I know Africa has problems. I'm not naive, but I genuinely I was not expecting to love it so much. For me, that Ubuntu, like that was something that for me was so enriching. Like I told you, I like ugly cried when I had first kind of experienced that sense of it. Even myself, I'm like I'm this strange white lady from America, and even still, like they were just like my community would just rally around me when I was struggling with kind of I was dealing with HIV positive children, so I was burying a lot of children, and it was very hard on me psychologically because these were kids that were living with me. They were orphaned, and so having to physically dig graves, it was very hard for me mentally. And the community just literally like embraced me, like literally embraced me, and I had never experienced that. Absolutely beautiful. And then I like that that Africa is people based more than time based. America, everything is time. Go, 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 money, money, money. We got to be there at thing. I loved Africa time. Like I loved that people are like, I'll be there in 10 minutes. And it was like two
I'll be
hours.
there 2 hours. Yeah, they're not
Literally,
good. 2, 3
I
hours
like
late.
it was an adjustment for me for sure. When I first moved there, I'm like, oh my God, people like get it together. But as I started to live there for more years, I loved it because I'm like, okay, like this is how life should be. Like, why are we in this big freaking rat race? Like, I like that it was just like about people and community and like and caring. And not that there was no individualistic components, but I liked that time was not nearly as important as it is in America. We're all frazzled all the time. Like we always are just like, got to be there. I got to go there. I got to do this. But there is just kind of like, okay, these things are going to get done. We'll get them done when they get done. Like it just felt like overall like it's just a more chill society. And I love the diversity. I love the food. I love the languages. I love the people. Africa is beautiful. Like it's such a lovely continent. And every nation I went to, I'm gonna have such wanderlust. Literally everywhere I went, I'm like Senegal. I was like, oh my God, I'm gonna move to Senegal. Morocco, oh my God, I'm moving to Morocco. Like literally everywhere I went, I'm like, this is the most beautiful, rich continent on the planet. It really is. I, you know,
Thank you.
I
Thank you so much, Dr. Inky-Shrink. I
yeah,
hope we can do this again. Can do this again, and hopefully, people are able to find your YouTube channel and follow it. I'm not quite sure you. I mean, if you have it, we'll put the link in the description so that people can follow your channel, on this video because this is a live stream and I'm going to upload the video as well,
sure,
so that people that are not here can rewatch it. It's good. It's packed. If you need a master class, if there's anything you want to learn relating to mental health, drug addiction, the drug fentanyl, pandemic in America, and a host of other social issues, make sure you watch this video, leave a comment, share the video if you can, and I hope we can see you again next time. Thank you
for
so much
sure.
for coming.
Yeah, thanks
I
for
really
having me.
appreciate it.
It was awesome. Yeah, thanks.
Yeah, thank you.